everybody. It's KUHSdenver.com with some of the best and great jazz music, but for now we're going to go live. As you can tell, we're live right now. And behind me I've got, of course, Monica Caballeros. I better get that right. It's for Connect for Health Colorado, and she's going to give us some insight about all there is to know about good insurance that you can buy or get inexpensively. So it's for everybody that it can't afford or is on a lower income-based situation. So I'm going to patch into you so I can share out for a while. Okay, so here we go. It's all yours.
Well, thanks so much for having me on. Almost exactly as you said, Connect for Health Colorado is the place to go if you need health insurance or if you have health insurance and are maybe looking for something more affordable. So we know a lot of people will qualify and get their health insurance through their job, or maybe they'll qualify for one of a public program like Health First Colorado Medicaid or Medicare, which is for typically folks 65 and older. But let's say you are not in those buckets, you are in a different situation. And maybe it's because you are a small business owner, or you work for a small business owner, or you're self-employed, or you freelance, or do gig work. And so you don't have that reliable source of health insurance, but you need to get coverage. That's where Connect for Health Colorado comes in. And in fact, we're also known as the we're the Obamacare place for Colorado. But that's a fancy way of saying you come to us and you're going to see a bunch of different types of health insurance companies, the ones that you know and recognize offering plans, as well as you can apply for financial assistance to cover the costs of getting health insurance. We have something a little bit new this year, which is thanks to the American Rescue Plan Act, which was signed by President Biden back in March. It actually gave more tax credits to people who are shopping through these Obamacare marketplaces, like Connect for Health Colorado for Coloradans. So let's say in the past you came to Connect for Health Colorado, you needed that health coverage, but you didn't qualify for those savings. Now is the time to come back because things have changed. There is more financial assistance available than ever before.
And it's really nice to have you on and tell us all about what's going on and knowing what's going on, because having you here live, given the firsthand of how to get this health insurance. Now we're going to talk about where they call, and I was going to put the number back here behind me. I forgot about that. Shoot. But we'll talk about the number and give them the number and who to call and when to call, so we can get that done real quickly. Now we have a summary of pre-open enrollment messages that we want to talk about. We got all the different things that you have here, financial help messages that we want to put out there. I've got it all here in front of me of things that by county, by areas, and we'll try to cover as much as we can in the short time that we have. I mean, we're giving you a lot of time, so you have plenty of time to do this. We've done this before. So go ahead.
And I look forward to it.
Go ahead, Monica, let us know.
All right. Well, the main thing, and I talked a bit about this, but it's really the name of the game. What's totally different is that financial help. And so when you go through Connect for Health Colorado, for example, we give out two different types of financial assistance. And historically it's been for people who maybe have lower incomes, but thanks again to this new law, now if you are kind of more in that middle range, you actually can now qualify for those tax credits. So it's a tax credit that covers that monthly health insurance premium that you get, and it's based on kind of, again, where you fall in that sliding scale of income. And then for people who are on the lower scale of income, you may also qualify for what we call cost sharing reductions. And that's a fancy schmancy way of saying that we can make your co-payments, your deductible, and co-insurance, those kind of other non-premium costs that come with health insurance, will make that more affordable for you. So again, if you have qualified, or pardon me, if you have applied to get Health First Colorado, and you were told, the state said no, you make too much money to qualify, but you're out there looking, and everything else, if you're going right to the health insurance company, it's still out of your budget. Connect for Health Colorado, we're the place to get started. The other nice thing is that you do not have to be an expert in order to buy a health insurance plan. You don't need to understand the jargon, premiums, deductibles. If you are saying, I don't even want to talk about that, or I just need something that is going to cover me when I need it, when I need to get health care, we have a network of certified brokers and what we call community-based assisters, which are really folks at nonprofit organizations all across the state who we work with to certify to help people apply for Medicaid, for Connect for Health Colorado plans and financial assistance. And then we also have certified brokers who can say, all right, tell me what your healthcare needs are, tell me what your budget is, who are the providers that you like to see, what's the frequency with which you go to the doctor or you need to see a specialist. They take all that information that you give them, a phone call, it could be a virtual appointment, maybe you're visiting an enrollment center, and they make it easy. They'll help you apply, and again, based on all those things you tell them, they'll say, out of all of these different options for you, this is going to be the best one that meets your budget and medical needs. So again, we have lots of resources to help you narrow down which health insurance plan is going to be best. But at the end of the day, you don't need to be an expert. Come to us. We have experts who can help you.
And you're talking about connecting with enrollment assistants, so that way they can go right to you. You'll have plenty of people who are knowledgeable on how to help you get and buy in this insurance. Now, something that's tailored to fit you. Now, there's a lot of people out there who are afraid to call, or they're unsure, well, I can't get it because of this, because of that. But all they have to do is call and find out, right? With the enrollment assistance program, you have plenty of knowledgeable people. Is that correct?
That is exactly right. So, again, it can be maybe if you're feeling overwhelmed, daunted, maybe that's not the case, and you simply just don't want to have to deal with it. You want someone else to do it. Come to us. We've got that free expert help, and it's free. I'll say it doesn't cost a thing.
And the thing about it is, you're going from November 1st to January 15th, so there's plenty of time to get enrolled. It's like if you're out of town or you're hearing about it and you want to get it done, you can still do it within this time period, and it'll come into fruition by what date? Is it by the 15th or by February 1st?
I am so glad that you asked about those deadlines. An open enrollment period is 2.5 months long, which seems like a bit of time, but you'll want to take action sooner rather than later. So if you enroll by December 15, that's the first big deadline, then your coverage is going to start by January 1. You can have your New Year's, celebration, maybe get a little wild. You have health insurance, it's okay. But if you don't come through and sign up until that last month of open enrollment, even though we keep the doors open till January 15, your coverage isn't going to start until February 1. So again, we know things happen. So if it is the case that it is after, if it's after Christmas, if it's after the holidays, I should say, you can still get enrolled, but take action sooner rather than later is what I'm recommending.
And what you guys put out there is that you can put out, based on your needs and your budget, there's a plan for almost everybody who has got low budgets or needing health insurance but can't afford it. Now, is there any deductibles associated with some of these plans?
That's right. So we work with 8 health insurance companies to offer truly, these are private health insurance plans. I know sometimes, when we talk about Obamacare, when we talk about health insurance marketplace, it can get a little confusing, but it's not, for example, it's not a state-run plan. It is truly we work with those health insurance companies, and recognize to offer these plans, and so they'll have a few different levels of benefits. For example, every single health insurance company has to offer plans at the bronze, silver, and gold level. What these mean is that basically different levels of coverage and benefits for you. If you are shopping at the bronze level, you're going to see those lower premiums, but to your point, you might kind of see you'll have a deductible, and you may even have a higher deductible. If you're shopping I think it's the Goldilocks level, silver, you'll have a bit of a higher premium, but you when you're going to the doctor, you're going to pay a copay. And so you don't, have to pay that deductible until some major medical thing comes up, like getting hospitalized. So silver plans are usually, again, the Goldilocks plans, nice for lots of people who may need to use their health coverage with a little more frequency. And if you're someone, say, who knows that they need a lot of care, or you have a chronic condition, then you may want to look at those kind of gold level plans, because those are going to have higher premiums, but they will have also lower deductibles, co-payments, because the health insurance company is sharing more in those costs with you.
Now you guys have this one tool. It's a quick cost and plan finder tool, which you can use anonymously. Now, they can go onto the website and put in their information and anonymously look for a plan? Is that the way this works?
That's exactly right. With, let's say you know, oh, this sounds good. I'm really liking this. I need
Yeah.
health insurance, but I don't know if I want to do that whole application right away. Or I want to see what's, you know, what's available to me before I do all that. Use this tool. It's our quick cost and plan finder. You can find it right from our homepage. We put the link everywhere so people can use it. Because in only a few clicks, and really it takes just a few minutes, you put in some basic, it's an anonymous browsing tool. You put in some basic kind of parameters. Let us know where you live, because that's what determines which plans are available to you in your area. And you will be able to see that estimated financial help, search by the providers that you care about and want to make sure are part of your plan. You can search by medications to make sure, again, what you need is going to be covered. And it really helps kind of streamline that process of figuring out what those options are, and we can quickly connect you to enrollment assistance if you decide, yep, let me go ahead and do that application and take a look.
And that will work out just fine for a lot of people who are unsure and they don't want to talk to anybody. They want to keep it on the down low. This works perfectly. Now, one of the other things about Connect for Health Colorado is you can find Connect for Health Colorado on the links on our website, kuhsdenver.com. Spanish or English, we have it translated into both areas. You can find, like you said, the links all over the place that we're pushing it. On some of our promo posters, we're pushing it right there, so the link is there. So all you have to do if you want to get onto the website, and it goes Spanish and English, you can convert right onto the website, or on some of our links, we have it already converted where you click on either the Spanish link or the English link. So you can go either way. Is that correct?
That's correct. We know that lots of folks, you know, in Colorado speak Spanish, or we have family members who speak Spanish, and so the entire website is completely available in Spanish, plus call center representatives, so we can help you in your language.
Now I was going to ask you, now COVID is really running rampant right now, and you've got this new COVID variant that's out and about. Now, if you sign up for this health insurance now, would it cover a pre-existing condition of COVID?
Yes. So, and it's a great question. When you shop through Connect for Health Colorado, you can rest assured that every single plan you get, whether you're at you're getting that bronze level that I discussed, or you're at that gold level, every plan is going to guarantee protections for people regardless of their medical history. We all have one, or what some folks say, you know, pre-existing conditions. So you are protected with any plan that you purchase, and every plan is going to include what we call essential health benefits. So again, you're shopping down here, you're paying more, you're shopping up here, doesn't matter. Every one of those plans is going to have some baseline of covering hospitalizations, laboratory services, your annual physical every year, necessary vaccinations, and the list goes on. There's 10 total, but you can know that you're getting something that is quality coverage in addition to being within your budget.
And some of these vaccinations are the zoster shots, which are for, you know, if you have shingles, you have the flu shots, you have all these variables that go with all these different shots, you know, that you have to get. And they cover some of these shots, correct, if you're in certain programs of the insurance. Is that correct?
That's right. These vaccinations are considered an essential health benefit.
And that's part of the program. Now, as we go on, you know, you got a lot of counties here. You got total plans by counties. Now, do they change, and are there variables in different counties because of the county governments, the way they run it, or it's the same all across the board?
Another great question. It is the health insurance companies who decide where to participate and where they would like to sell plans. And so they will submit every year their plans about where they're going to go, in which new counties they're going to be offering plans, how many plans, and the prices of those plans to the Division of Insurance, which is the state agency that helps to regulate and provide oversight to where they're offering that plan choice. And so we just kind of take in those plans from them. And so that's, I think what I'm trying to say is that we don't decide where those plans are sold. But the really good news this year is that we're continuing to see a trend where more health insurance companies are entering into the overall marketplace where people are buying plans. And historically, especially, you know, on the western slope and in some of the mountain areas, there had only been maybe one health insurance company offering plans, and so folks living out, you know, not just along the Front Range, really didn't have quite as much choice. That's changing. So now there's, some two, sometimes three different health insurance companies offering the variety of plans. And so you're looking at, again, just really increased plan choice, which is always good for, for you because plans change by network and by price. And it's just nice to have more options to make sure you're getting what you need.
Now, there's a big delay in hospitalizations because there's no beds, there's no, if you go to the emergency rooms, there's all these variables too. So is there a part in these plans where instead of going to the hospital to go stay, there's other places you can stay or, to recover? And does it cover any of those places? Because I know in some of the hospitals right now, they're they're completely filled up to capacity. And so when you go there for a health service or something's wrong, does it cover you if you have to go to another facility of any sort?
That is a great question about how robust the networks are that the health insurance companies say we're going to cover XYZ providers, so these are the different places you can go. I don't know if I can directly answer your question because the plans vary by which, hospitals, providers, people that they cover. I think this really underscores to me, though, the importance of working with maybe that certified expert who can really help you, check off and say, yes, actually, this is a hospital that I want to be able to go to. So they can help you kind of sort out and make sure that you're getting a plan that is going to have a nice excuse me, I'm trying not to use too much jargon, but we'll have that really nice big, what they call provider network, which is basically the approved places you can go that the health insurance company is going to share in the costs with you. So I say, to that concern, connect with that certified broker or maybe use our tools, give the health insurance company a call to make sure the places that you need covered are covered in the plan.
Okay, Monica, here's what we're going to do on this next 3 minutes. I want you to go ahead and convert some of this in Spanish, not all of it, some of it. So that way we need to know about the telephone number, how to get a hold of you, the website, what areas and counties that you're all covering. If it's all the counties, you want to go over all the different counties. And talk about how you can get the health care, through Connect for Health Colorado, but convert it into Spanish. Por favor, ándale pues, dale gas.
Muchísimas gracias. Connect Colorado es el mercado oficial de seguros de salud para los habitantes de Colorado. O sea, somos la organización Obamacare para los residentes de Colorado. Somos el único sitio para solicitar ahorros para cubrir los costos de un seguro médico privado. Y trabajamos con 8 compañías de seguros médicos para ofrecer planes médicos y dentales a los habitantes de Colorado. Somos también el sitio donde puede recibir asistencia con el proceso de inscripción y tenemos una red estatal de agentes certificados y asistentes comunitarias que pueden guiarlo por el proceso de inscripción, brindar consejo y responder a todas sus preguntas acerca del Connect for Health Colorado y cómo aplicar para el programa Health First Colorado, el programa Medicaid. Este año, gracias a una nueva ley, puede obtener más ahorros que nunca para cubrir el costo de un seguro médico. 4 de cada 5 personas pueden calificar para planes por $25 mensuales o menos. Así que si no has calificado para recibir ayuda financiera en el pasado, ahora es buen momento para volver a presentar su solicitud y adquirir un plan médico por medio de Connect for Health Colorado. El periodo de inscripción abierta es el momento en el que puedes adquirir un plan médico o cambiar de su plan actual si es cliente actual. Y es desde ahora hasta el 15 de enero del 2022. Tienen que inscribirse antes del 15 de enero porque fuera de este periodo de inscripción abierta tienen que tener un evento calificado como mudarse, casarse, tener un bebé para obtener un nuevo plan. Mi mensaje es sencillo. Si necesitas seguro de salud para este año y si no tienes seguro médico ahora, pero Connect for Health Colorado es el lugar para recibir asistencia con los costos y con el proceso de inscripción.
And that was well done because there are because we're a bilingual format throughout the station. We have about 3 different shows. We have a lot of people who do speak Spanish, and there you go. So that way you feel more comfortable with what we're telling you about Connect for Health Colorado. You're listening to Monica Caballeros of Connect for Health Colorado, directly from her of what's happening here with Connect for Health Colorado. Go to our website, and you can click on the link, Spanish or English, and go right to the website. You can find it on all the links on some of our promo posters, or you can just find it anywhere. Just Connect for Health Colorado is such an easy name to remember. It's easily coined. It's a name that you can remember so easily. Tell your friends, your brothers, your others, lovers, mothers, sons. Tell everybody about Connect for Health Colorado as we give it this big push. And then the dates are, again, that you can get enrolled, and then I think it's January and February are the 2 dates, right?
That's right. And we're open now through January 15. You can sign up for January or February coverage.
Well, Monica Caballeros, it's been real. It's been fun. You always bring such warmth to the community and to our our network has really grown. It's grown huge. Just in 1 year because of this COVID thing and what we're doing here, it's grown big. And so it's bilingual. There's a lot of bilingual places here that listen to us from all over the western slope, eastern slope, all over the place. They're listening to this station. Now, one thing we want to cover is the Native Americans, and we always do this. So if you got some time, let's go over that with Native Americans and how they can get Connect for Health Colorado insurance also.
So the good news is that members of federally recognized tribes can enroll in health insurance during the open enrollment period, but also year-round. And they may also qualify for healthcare discounts and may be eligible for even more financial help to lower their monthly premium. So really, you can find plans for starting from $0 and even having those really, really low co-payments. And so again, now is the time to take action. The good news is that if, for example, you are a member of a federally recognized tribe, you signed up during open enrollment and you say, oh no, that actually wasn't the plan I needed, you will have another chance. Simply give us a call, get in contact with us or your broker, and we'll be happy to help you change that plan or review your income, make sure you're getting as many savings that you qualify for.
And KUHS is partnered with a lot of the different tribes, and we've been posting up a lot of the pictures that they're posting up there. So I'm sure a lot of them are listening because they do listen to some of our shows. And so if you heard that right now, if you didn't catch it, you can replay this broadcast and listen to what Monica Caballeros has to say. With that being said, it's been a pleasure talking to you again. You always bring, like I said, such warmth to the community for healthcare and health insurance. So anything, one last word?
I don't think so. We have tons of help. Don't feel overwhelmed. Don't feel daunted by this process. Health insurance, is not the sexiest topic, but we're here to make sure that you don't have to do the hard work. Let us do the hard work. You just got to give us a call.
The sexiest topic. I like that. There you go, from Monica Caballeros for Connect for Health Colorado. As we say goodbye for this broadcast, replay it if you didn't catch some of it. Share this broadcast out. It can be reshared. It's being restreamed on YouTube, onto our website, on Twitter, all the different social media sites simultaneously, also to YouTube if you can't catch it.